Hello everyone, how are you all? I hope you people are all doing good. I'm also doing great. So I just wanted to start with the next lesson in 7th class, that is second unit, third lesson, that is Susruta. So you can see on the top, Susruta, an ancient plastic surgeon. So we are going to study about a great surgeon. It was many years ago, it was some centuries ago. Centuries ago. So how did he do plastic surgery? Nowadays we have a lot of equipment. Nowadays everyone like equipment is we have advanced equipment. In those days we did not have any equipment. We did not have anesthesia at least. So how did they do operations? How are the operations done in those days? Let's see. Yes. So first I'll read by paragraph and then I'll explain. It was midnight when Susruta was awakened by a frantic knocking at the door. Who was out there? Asked the aged doctor, taking a lighted torch from its socket in the wall and approaching the door. So it was midnight and this ancient doctor, this old doctor, aged doctor was sleeping. And there was a frantic knocking at the door. What do you mean by frantic? Frantic is nothing but fear or anxiety. Okay. Fear or anxiety. Frantic is nothing but fear or anxiety. So with fear, he was knocking at the door. He was just knocking at the door. The person is outside. Who is out there? Asked the aged doctor. This aged doctor asked, who is out there? Taking a lighted torch. He took a lighted torch from the wall, from its socket. So in those days they did not have any lights, electricity was not there, right? This torch here is nothing but, have you ever seen Olympics torch? Like there will be a big stick and on the top of the stick there will be fire glowing, right? The same way in olden days they used to have a big long stick and to the one end of the stick they will just tie a cloth which is immersed in kerosene and then they will set fire on it so that it will stay for some time. Okay, that is nothing but lighted torch. From its socket in the wall and approaching approaching the door. So he took out the torch and he started approaching the door. I am a traveler, my revered Susruta, was the anguished reply. A tragedy has befallen me, I need your help. I am a traveler, my revered Susruta. What do you mean by revered? Revered is nothing but respected. Okay. You will say when we see the scenes in the court and all that, they say your honor or my honor, right? The same way here he is talking with respect. My revered Susruta. Okay. Was the anguished reply. A tragedy has befallen me. I need your help. So I have a tragedy has occurred to me. A big accident has happened to me. Has befallen me. What is befallen? Especially something bad happened. Befallen is nothing bad. Especially something bad happened. Okay. Susruta opened the door. What he saw was a man kneeling before him, tears flowing from his eyes and blood from his disfigured nose. So when Susruta opened the door, so he saw a man kneeling. What do you you mean by kneeling? So you sit on your knees when you do prayer or when your teacher gives you punishment, right? That is called kneeling. You sit on your knees. Okay? Kneeling before him, tears flowing from his eyes. There were tears from his eyes and blood from his disfigured nose. So there is no shape out. There was no shape in his nose. The nose was disfigured, means shapeless. Get up, my son, and come in, said Susruta. Everything will be alright, but be quiet now. Get up, my dear son. Come inside. Everything will be alright. Don't worry. Be quiet for now. He led the stranger to a neat and clean room with the surgical instruments on its walls. He washed his face with with water and the juice of a medicinal plant. He then offered him a mug of wine and began preparing for the operation. So he led the stranger. He took the stranger. He showed him to the way. He showed him way to the neat and clean room with surgical instruments. What are surgical instruments? Surgical instruments are nothing but instruments used to perform a surgery, okay, on its walls. So there were surgical instruments on the walls. He washed his face with water. So Susruta washed the stranger's face with water and juice of some medicinal plants. So he took out juice of some medicinal plant and he washed the face of the stranger. He then offered him a mug of wine and began preparing for the operation. So gave him a mug of wine and he started making preparations for the operation. So why did he give wine? Let's see now. With a large leaf of a creeper brought from the garden, he measured the size of the stranger's nose. Taking a knife and forceps from the wall, he held them over a flame and cut a strip of flesh from the stranger's cheek. The man moaned, but the wine had numbed his senses. So what happened? He took out a large leaf from a creeper from from his garden and he measured the length of the nose. So he measured the length of the nose, how much skin he needed, and he measured on his cheek and he cut the cheek. With what did he cut? He cut the cheek with a knife and a forceps. So what did he do? So he heated the knife and forceps in flame. So he heated the knife and the forceps because to sterilize it. Yes. In olden days, nowadays we are using the disposable syringes and all that, right? So in olden days they used to use sterilized injections, which means they used to boil the injections in hot water, boiling water, and then they remove them and then they will get the injection. But nowadays we have disposable injections which are one-time use, right? They use it and then throw it. Okay, in those days, so he took out the knife and forceps from the wall and he held them on a flame and he cut a strip from his cheek. Okay, and he took out a part of his cheek. The man moaned, but the wine had numbed his senses. The man made a small sound, like that, and numbed his senses. So he took wine, right? So Susruta gave him wine. Why did he give wine? Because in those days there was no anesthesia. Anesthesia was not there. So he gave wine to make numbed means, I'll write with the meaning. What does mean by numbed? Numbed is nothing but a sensation to be felt less intense. A sensation to be felt less intense. Okay. So, it's a sensation. So, you will not feel much intense. Like there will not be much pain. Pain will be reduced. Okay, that part, this part, so when we took out that part, cheek, skin, so that part will have less intense and less pain. Okay. After bandaging the cut and the cheek, Susruta cautiously inserted 2 pipes into the stranger's nostrils and transplanted the flesh to the disfigured nose. Molding the flesh into the shape, he dusted the nose with powdered liquorized red sandalwood and an extract of Indian barberry. Okay, he then enveloped the nose in cotton, sprinkled some refined oil of sesame on it, and finally put a bandage. So what did he do? First, he put up a bandage on the cut cheek part and he took the skin. And what did he do? So the nose was disfigured, right? So he wanted to give a shape to the nose. What he did? He can't just put the skin on the nose, right? So if he put the holes will get closed. So what he did, he put some 2 straws into his nose, and then he put up the skin, what he took out from the cheek. Okay, and what he did then, so he molding the shape. So he molded the shape of the nose by dusting with powdered licorice. Licorice is nothing but an extract from a medicinal plant. Okay, medicinal plant, what kind of plant it is? It is like a glycyrrhiza plant. It's a medicinal plant. Okay, you remember it as a medicinal plant, the powder from a medicinal plant. Okay, and red sandalwood powder. You all know what is sandalwood. Okay, and an extract from Indian barberry. So Indian barberry is nothing but it's a kind of turmeric also. You say kasturi in Telugu. Okay, it's a kind of turmeric powder. He then enveloped the nose in cotton, sprinkled some sesame oil on it, and finally put up a bandage. So what he did, he enveloped the nose in cotton. So what he did, he put some nose in the cotton and sprinkled with some refined sesame oil, sesame seeds. You all know sesame seeds, right? And put up a bandage. So finally he put a bandage. Before the traveler left, he was given instructions on what to do and what not to do on a list of medicines and herbs he has to take regularly. He was also asked to come back after a few weeks to be examined. So what he did, the traveler, before that leave, so the same thing also happens to us, right? So before we leave the hospital after any operation or after falling sick, when we go for treatment and when we are going back home, what they do, the doctor will prescribe you some medicines, how to use it and when to use it, what are some creams like that. The same way, here Susruta also gave the traveler some instructions, what to eat, what not to eat, okay, what are the medicines to take, everything, all the herbs, everything he gave. He was also asked to come back after a few weeks to be examined. So after a few weeks, he was asked to come back for examination. In this manner, Susruta mended a nose some 26 years ago, centuries ago, sorry. So in this way, Susruta mended the nose some 26 years ago. And what he did is not greatly different from plastic surgery all over the world. His treatise, Susruta Samhita, has considerable medical knowledge of relevance even today. It indicates that India was far ahead of the rest of the world in medical knowledge. Okay, so in this manner, Susruta mended a nose. Mended. What do you mean by mended? Repaired. Mending is nothing but repair. So if your shoe is repaired, if your shoe is torn or if your slipper is torn, what do? You take the repaired shoe to a cobbler and he will mend it. He will do the repair part. Right? Same way here. When did Susruta mended a nose? When did he do plastic surgery? Some 26 centuries ago. Some 26 centuries ago. So when did he do? Some 26 centuries ago, he did a plastic surgery. Who? Susruta. Okay. In fact, Susruta is today recognized as the father of plastic surgery. Who is known as father of plastic surgery? Susruta is also known as father of plastic surgery. Okay, is it clear? Father of plastic surgery. Okay, then. In fact, Susruta is today recognized as the father of plastic surgery all over the world. His treatise Susruta Samhita has considerable medical knowledge of relevance even today. It indicates that India was far ahead of the rest of the world in medical knowledge. So his treatise, what do you mean by treatise? Treatise, what do you mean by treatise? Treatise is nothing but formal and systematic. It's a discourse, like it's a book, and it's a very systematically written, formal and systematic discourse. It's a formal and systematic discourse of some subject, okay, of any subject. Susruta wrote Susruta Samhita. It's the name of the book which was written by Susruta. So that is remained as relevance. It is the main subject. The quality or state being closed. Relevance. It is remained as a relevance for all the medical students, medicinal for all the medical operations and all that. Okay, it indicates that India was far ahead of the rest of the world in medical knowledge. So this surgery indicates that India was far ahead. It was ahead of the world many centuries ago. Okay. So now let's see who is Susruta. Susruta was born in 6th century BC. So when was Susruta born? Susruta was born in 6th century BC. We'll write down here. So when was he born? 6th century BC. So Susruta was born in 6th century BC and he was a descendant. He was the descendant. Means his forefather was Vedic sage Vishwamitra. He was the descendant of, the next point is descendant of Vishwamitra, sage Vishwamitra. So who was the descendant of sage Vishwamitra? Vishwamitra. Okay. So you have to remember all these points. And he learnt surgery and medicine at the feet of Divodasa Dhanvantari. So he learned. Where did he learn? He learned at the feet of Divodasa Dhanvantari. Was his guru's name. Okay. At hermitage in Varanasi. Where did he learn all these things? In Varanasi. Okay. Later he became an authority in not only surgery but also in other branches of medicine. So he became very famous, or he has good hands-on experience not only in surgeries but also in other medicine branches of medicine. He was the first physician to advocate what is today known as the Caesarean operation. So he was the first physician. So Susruta was the first doctor who advocated Caesarean operation. Caesarean operation is nothing but cutting out mother's womb and bringing out the baby. Okay, that's called Caesarean operation. So he was the first person who did it. He was also an expert in removing urinary stones, locating and treating fractures, and doing eye operations for cataract. So he was also an expert in removing urinary stones. He was expert in removing urinary stones. He was expert in repairing the fractures of any bones. Okay, and doing eye operations for cataract. His suggestions was to give wine to patients about to be operated upon. Makes him also the father of anesthesia. So he is suggesting, what is he suggesting? He is suggesting to give a cup of wine to the patient who is going to be operated, because it works like an anesthesia. It numbs their senses. It numbs the patient's senses. Okay. He is also known as father of anesthesia. Father of anesthesia. Who is called father of anesthesia? Susruta. Right? You can all see it. He is also known as father of anesthesia. His treatise Susruta listed 101 types of instruments in his treatise, in his book Susruta Samhita. He listed 101 types of instruments which are very useful for operation surgeries. Okay, his Samdamsa yantras are the first forms of the modern surgeon's spring forceps, dissection and dressing forceps. Okay, so he used to call them as Samdamsa yantras. The surgical instruments were called as Samdamsa yantras. Okay, they are the nowadays moderns like dissection forceps, spring forceps and all these things. In fact, the system of naming surgical tools after the animals or birds the resemble in shape. For example, crocodile forceps, hawksbill forceps is adopted even today. So, how did he name his instruments? He named his instruments after the names of animals or birds, like how they look, the nose of a hawksbill, okay, or the mouth of a crocodile. So he used to name the forceps on how they resembled to the to the surgeon. Okay, like crocodile forceps, oxbill forceps is adapted. So these two were adapted even today. Susruta was also an excellent teacher. He told his pupils that one could become a good physician only if one knew both theory and practice. He advised his pupils to use carcasses and models for practice before surgery. Susruta was also an excellent teacher, not only excellent physician, surgeon, but he was also an excellent teacher. He told his pupils, what do you mean by pupils? Pupils are nothing but students. What do you mean he saying his students? A good physician is who knows theory and practice. Both they should know. They should know theory and practicals. Okay, they should know theory and practicals. And he advised his students to use carcasses. What do you mean by carcasses? Carcasses or nothing but dead bodies. Carcasses or nothing but dead bodies. Carcasses are nothing but dead bodies and models for practice. Before surgery, he used to suggest them to practice on carcasses and dead models. Let's move on to the question answers. Why did Susruta offer the traveler a mug of wine? So why did Susruta offer the traveler a mug of wine to do some party? No. He wanted to numb his senses because he is operating and he is suffering from pain. The traveler is suffering from pain. So he wanted to numb his senses. Why was Susruta recognized as the father of plastic surgery even today? So Susruta was recognized as plastic surgery, father of plastic surgery, because in those days, mostly 26 centuries ago, Susruta did his first operation, plastic surgery, without any advanced equipment. What made him the father of anesthesia? What made him the father of anesthesia? So Susruta used to give the patients who were going to be operated a mug of wine because to numb their senses and make them feel less intense or less pain near the place of surgery. Okay. Who could become a good physician according to Susruta? So who could become a good physician? The good physician should be excellent in not only he should know only theory, but he also should know practicals also. He should have good knowledge on theory and practicals, and he also suggested his pupils to do experiments mainly on carcasses and models. What was his advice to pupils? What was his advice? He advised his pupils to use carcasses and models for practice before surgery. So before doing any surgery, he advised his pupils to practice on carcasses and models. Okay, that's all for today, my dear students. So meet you in the next class. So if you want any other lessons to be taught, you can put it in the comment section below. Okay, thank you for listening. Bye bye. And one more thing I just wanted to tell you, if you are new to my channel, please hit the subscribe button, and if you like my video, give it a thumbs up. Thank you. Bye bye.